Hi guys, thanks for tuning into our video. My name is Lindsay and this is Tatum, and we are both recreation therapy students at the University of Toledo. And today we're going to be taking you through an intervention that practice social skills and assertive communication for individuals who are experiencing PTSD from domestic abuse.
And to reiterate, the population that we're focusing on through this intervention is adults ranging from 18 to middle age whom have been diagnosed with, again, PTSD with domestic abuse. Some symptoms associated with PTSD, according to RT for specific diagnosis and conditions, include avoidance, anxiety, flashbacks of the event, nightmares, disassociation, and feeling of emotional numbness.
And some ICF codes that correlate with this intervention are handling stress and other psychological demands, interpersonal interactions and relationships, and managing one's behavior.
And also, one long-term goal of this intervention will be to increase communication skills, and then another short-term goal will be to increase interpersonal relationships. Based on this population and intervention, we are going to give you just a short demo of the intervention that would be taking place normally about twice a week, Tuesday and Thursdays per se, for 60 minutes, and it could be with a group of 10 or less, or what we're demoing is just a one-to-one session.
Before we start this intervention, we are going to touch on some of the goals and objectives that we have for our patients. So just to reiterate, our long-term goal is the patient will increase communication skills. A short-term goal is to increase interpersonal relationships. An objective for this goal is patient will verbalize to the CTRS or their partner at least one I statement that they created during the session.
And then another short-term goal that could be implemented throughout this program is to increase the assertiveness in their communication. The objective that could go along with this goal is after a demonstration by the CTRS, the patient will independently create an iMessage that they could use in the future in a scenario, and they will do this in a time frame of 10 minutes.
And the CTRS uses goals and objectives to develop a treatment plan for their patient. They also use goals and objectives to track the patient's progress throughout treatment.
Yep, and then also for this program, there may be some risk management that the CTRS or the one that's offering the group should be aware of. Some things to consider would be provoking scenarios. Although this program is meant to be, provoking and triggering for the client, we want to make sure, that everyone does feel comfortable. And if a scenario is too much for that client, the CTRS or the partner could pick just a different scenario to make the partner, continue to participate even though the scenario made them feel uncomfortable. Another thing would be like the hazardous environment, so just removing all objects that may cause harm or just like an open space for everyone to participate. And also in times like today, safe social distancing may be appropriate just to keep everyone safe.
According to the Diversified Rehab Group, patients diagnosed with PTSD can benefit from exercises such as these with the I statements, utilizing assertive communication, and to practice out role-playing exercises.
And then the benefits of practicing the iMessage statements and role play are maintaining self-control, behaving as an equal to others, listening and responding appropriately, accepting one's own responsibilities, and managing one's stressors.
So the CTRS prior to a starting group would have created prompts and the scenarios that you will see in the next video.
So now we are going to implement the programming by utilizing iMessages. I'm going to be acting as a CTRS.
And I'll be acting as the patient, and we'll be using I statements to assert how these situations make us feel. An example of an I statement is, I feel blank when you blank.
Our first scenario, I'm going to be acting with Lindsey. Lindsey, the scenario would be you and your partner in the kitchen in a close proximity, and your partner then unintentionally moves you out of the way inappropriately. How would you respond effectively using the iMessage statements?
So I feel belittled when you physically push me out of the way. I would prefer if you asked me nicely to move.
And that's a positive statement. In this scenario, that is how you would respond assertively and effectively communicate your feelings. Another scenario would be, Lindsey, if you imagine your partner asks you to grab a jug of milk from the grocery store, and you're on your way there, you grab everything you thought you needed, and then you realize you forgot his milk, and when you get home, you reiterate that to him, and he gets in a rage and starts screaming and yelling at you. In that scenario, how would you respond effectively?
So I don't appreciate when you raise your tone of voice at me. I would appreciate if you would talk to me in a calm tone.
And that is just another way that you would use iMessaging to effectively respond to your emotions. As you, the audience, have witnessed, these are just two examples that you could use in a scenario that you are feeling uncomfortable with iMessages. The session would continue, obviously, going on with scenarios and responses utilizing iMessages an effective tone.
And these scenarios are designed to be triggering. However, if any of these scenarios are too provoking for the patient, it would be advised to switch to a different scenario.
Mm-hmm. And then as a CTRS, you may ask your group at the end some processing questions just to help them engage in the group and really understand why it is that they participated in the group and their benefits from the programming. So I'm going to ask Lindsey 2 questions, and she's going to give an example of how we would like a person to respond in a group. So Lindsey, let's see. How did expressing your iMessage statements to me make you feel, and why?
It felt empowering to be able to say how the situation was making me feel. I feel like I was able really to get my point across.
Right, exactly. And that's what we want out of every intervention or statement or iMessage. You know, if someone feels uncomfortable, we want them to express how they're feeling in a mannered tone. We wouldn't want someone to yell back at the person that may be making them feel uncomfortable, because that is not being assertive. Another question, maybe, how would you plan on using iMessage statements in the future?
So in the future, I would definitely use iMessages to get my point across and to assert myself in any uncomfortable situation or any triggering situation that may come about.
Exactly, and that is what we want our clients to benefit from this program. Obviously, is to learn to better communicate, again, in uncomfortable situations. So, which is what we accomplish.
So thanks for tuning in to our video, guys. We hope this helped explain a little bit better on how to practice assertive communication.
Thank you.